Imagine if you could find faster, smarter ways to build the life-saving drugs of tomorrow by combining the creativity of chemistry with the precision of artificial intelligence. Our next speaker is doing just that by reimagining how the discovery and create molecule. Masha Elkin is a chemist who fuses the worlds of organic chemistry, artificial intelligence, and molecule design to tackle some of the biggest challenges in sustainability and the future of synthetic chemistry. Her work combines the precision of catalyst development, the complexity of natural product synthesis, and the power of machine learning to design entire new chemical reaction and to do it faster than ever before. After completing her undergraduate studies in chemistry at the Washington University in St. Louis and her PhD in Yale University, Dr. Elkin joined MIT as the Dr. Reed and Barbara Whedon Career Development Assistant Professors of Chemistry in July 2023. Please join me in welcoming a scientist who is creating shortcuts to life-saving molecule and accelerating the chemistry of the future, Masha Elkin.
You know, every time I'm in one of these rooms, I think back to 5 years ago when we couldn't be in a room like this. Because in April of 2020, we were in the middle of the COVID shutdowns. We couldn't go to work, we couldn't go to school, we couldn't go to the grocery store. What was scariest about April 2020 is how far it felt like we were from a treatment, from a cure. And that's because conventional wisdom has always said that to make a new medicine, it takes 10 years and $1 billion. But what was incredible about April 2020 is that we weren't 10 years away. We were just a couple of months away. By November of 2020, we had remdesivir, the first intravenous treatment for COVID. By December, we had the mRNA vaccines getting rolled out to billions of people worldwide. Shortly after, we would get oral treatments, pills for COVID, like Paxlovid. Paxlovid went from an idea in a chemist's mind to in the clinic in people in just 12 months. It didn't take 10 years. What COVID taught us is that we're not limited by the science. We had been developing the mRNA technology for years, for decades, much of that work done here at MIT. What COVID taught us is that we're limited by the time, the resources, and our commitment to these challenges. If we want to develop medicine for the next global health crisis, for our current global health crises, right, for Alzheimer's, for diabetes, for metastatic breast cancer, we can't afford to wait 10 years. And we can't rely on a global pandemic to motivate us to move on these issues. What we need to do is become smarter and more strategic about how we use our time, our resources, and what challenges we commit to. So they say it takes 10 years and $1 billion to make a new medicine. Well, that's because the pill you take in the morning is made of molecules. Those molecules are organic, they're made of carbon, and all of our carbon is black. It's oil, it's coal, and that carbon is refined to small molecule building blocks that a chemist clicks together like Legos to make complex molecules like drugs. That process is really inefficient. To make a small molecule drug like remdesivir, 1 pound of remdesivir takes 200 to 300 pounds of building blocks. That's the organic molecules that go into the actual drug. That's also the solvents that they swim around in, the catalysts and reagents that click them together. For more complicated drugs, for Ozempic, it's not a few hundred pounds. It's 15,000 pounds of raw materials that go into every pound of Ozempic made. And to develop medicine, you have to repeat that process over and over again until you find a structure that's as safe as possible, as effective as possible, able to be produced to meet patient demands, with minimal side effects to hit as many patients as possible. It's a really inefficient process. And if we want to get better at it, we have to be better at using our time, our resources, and knowing what problems we want to commit to. So in my lab at MIT, we look at how people actually make drugs. We look at the pharmaceutical landscape, we analyze millions of patents, and we use machine learning and informatics to reconstruct the synthetic sequences that companies go through to go from organic building blocks to the actual drug molecules. We then look for similar subsequences across that landscape. And we find patterns all over the place, the same sequences that everyone seems to be using at different companies for different drugs. One of those sequences really caught our eye. People want to go from alcohols to amides. And that's because alcohols are really widely available. They're easy to get from coal, from oil. And amides are the backbone of life. All of your enzymes, all of your proteins are made up of amides. They're common in medicine because they're common in nature. But we don't have a reaction that can go from an alcohol to an amide. It doesn't exist yet. A chemist hasn't invented it yet. So what everyone does instead is this 4-step sequence, from alcohol to sulfonate to azide to amine to amide. And that's not a very efficient process. We're going through 3 intermediates that we don't want. Each of them generates waste, takes time, takes resources. And more importantly, that middle intermediate, that azide, is explosive. Okay, sodium azide is what makes your car airbag explode when you get in an accident. It's not the kind of thing you want to be producing on scale when you're trying to make medicine. What we need is a shortcut. What we need is a 1-step reaction to go from alcohol to amide. And now that we know that, we can apply our time, our resources. We can commit to that problem. Jonas can commit to that problem. Jonas is one of our incredible international postdocs, and he took this on, and he solved it in 4 weeks. Jonas invented the 1-step alcohol to amide conversion. He did it in 4 weeks because we were never limited by the science. It's not that the reaction couldn't be done or that we had no idea where to start. It's that we didn't know that that was a pain point that we needed to apply our time and our resources to. And now that we have this reaction, this sequence that used to take 4 days to run is done in just a couple of hours. And we can apply this across that pharmaceutical landscape, and we can keep looking for these inefficiencies, these patterns, and keep inventing the shortcuts that bypass them. So if we want to make the next generation of medicine, if we want to be able to make medicine faster, to produce it more quickly, to make it cheaper, to make it more accessible, safer, then we need to be developing these shortcuts. And it's bigger than even medicine. If we want pesticides that don't harm the environment, if we want fertilizers that are ecologically sustainable but allow us to tackle food scarcity, if we want plastics and polymers that don't degrade in our body and in our atmosphere but are recyclable and renewable, we need new molecules. It's a chemist's job to make those molecules. They're all organic and they come from organic building blocks. It's my job to make us better at how we make molecules. And so when you go home and your friends ask you, when are we going to get our flying cars, our robots that just do dishes and laundry? When are we going to get cures for dementia or depression? Tell them, we're not limited by the science. We're limited by our time, our resources, and our commitment to those problems. And at a place like MIT, we need to think limitless. Thank you.